Are we good?
Yeah.
Okay. So one of my favorite conditions that I see come into the office is people with autoimmune disease. And the reason why is because most people come in here for pain, and they don't really get the power of chiropractic. But people with autoimmune disease that come in, and all of a sudden they get adjusted and their body starts to heal up, they really have a much greater appreciation for what chiropractic does. So this is something very near and dear to my heart because I grew up with autoimmune disease. I had asthma for 23 years from ages 5 to 28 before I went to a chiropractor. Took tons of drugs and tons of immune suppressant drugs during that time, and I still had asthma. And so I went to a chiropractor and that all changed. So I'm going to explain exactly why these cases are so great in chiropractic and how it works, at least the way that I believe it works. So an autoimmune disease is a condition where the body is malfunctioning so badly that it actually starts to attack itself. And what happens is the immune cells, the T cells, which are created in the thymus, the T cells start attacking organs or glands or whatever because they think it's an invader or something bad. And that becomes, what happens is it starts attacking the organ, there's a lot of inflammation, and then they start to malfunction. For me, my thymus was attacking, the T cells from my thymus was attacking the lungs. The killer T cells were in the lungs, attacked the lung tissue, creates a lot of inflammation so I could breathe in, couldn't breathe out. I was wheezing all the time. So that could go on for the colon, for ulcerative colitis. It could go on for Hashimoto's thyroiditis if the T cells attack the thyroid. If the T cells attack the joints, you can have rheumatoid arthritis or psoriatic arthritis with the skin. So there's tons and tons of autoimmune diseases. For the pancreas, diabetes, tons and tons of autoimmune diseases, okay? So when people come into the office, what we're looking for is a condition in chiropractic called subluxation. And a subluxation is a condition where the vertebrae that are supposed to protect the nerves coming out, instead of protecting those nerves, they start to shift backwards and they start to interfere with the nerve. That's called a subluxation. It's when the vertebrae shifts back and it starts to interfere with the nerve instead of protecting it. And during this time, discs herniate and there's a lot of damage in here. So what a chiropractor does is find that blockage and give that an adjustment. And all of a sudden that starts to restore that nerve supply and that body can start to work more normally. It's very, very simple. So we've seen quite a few of these in our years at the office here. And of course, nobody ever shows up with this. They always come in with neck pain or back pain or headaches. But the great thing about chiropractic is it doesn't matter. The only side effect of chiropractic is the body functioning better. So this is one of my favorite all-time cases because the pathology is so very clear on this. This is a patient that came in here. His first visit was in 2019, April 3rd, and this second visit the second x-ray is taken on 5/20. So about 7 weeks later, this second x-ray is taken here, or excuse me, about 7 weeks later, the second x-ray is. Patient came in with neck pain. He came in here because his wife did. When we started scoping him, I started asking him questions. He had pressure certainly in the thymus area here. He had pressure right at the sacrum. So we started adjusting him, and you can see this is the post x-ray here. Well, he's a lot straighter on this one here. Certainly he's lining up better. But the pathology that you're seeing starting to disappear is this undigested fecal material. So what I found on this patient in the history is he had been suffering with ulcerative colitis for 17 years. The past 5 years he was taking sulfasalazine, and that's an immunosuppressant drug. So the way the biological drugs and these immunosuppressant drugs work is they suppress the inflammatory response that's caused by the thymus. So there's no inflammation in there, and when there's no inflammation in the organs, the inflammation doesn't destroy the organ tissue, the bleeding stops, patient feels better. But the problem anytime you use something like an immunosuppressant drug is it suppresses inflammation and the immune system system-wide. So somebody like this is going to be very, very susceptible to anything, any bugs or anything, cancer, any type of environmental pathogen. So when I take a look at this, so you can see right here, lots and lots of undigested fecal material. And if you look over here, most of that is amazingly gone. So how did that happen? Symptomatically, this was taken 7 weeks later. At this point, he said he was 70% better, and he was taking half of his medication at this point. The 8th week, he stopped taking medication completely, and this guy just does periodic maintenance in at the office right now. So and then at the end of 3 months, of course, his body had completely healed himself from ulcerative colitis. This is not the only other one. This is not the only one. We have a lot of these, but there's at least 5 of them that I remember. I just don't remember a few of them. I did remember this woman though, and she came in with ulcerative colitis, and for the first 2 months, we didn't see much change. There was a 20% difference, and she said there was less discomfort and bleeding. And by the end of this, 2.5 more months after that, that was 75% better, no bleeding and less discomfort. So no bleeding anymore. Pretty amazing. That being said, also some of the other things she reported was 85% better menstrual cycle, shorter and no clotting. Sciatic pain was gone, 100% gone, and well, the bloating was much better too. So anyway, what I'm trying to show here is the body has the innate ability to heal itself if there's no interference there. It's very, very simple. So for people that are suffering with autoimmune disease, now interestingly enough too, with this guy, if you look at that date on there, well, you can't see it. This was taken on April 3rd, 2019, and you can all remember what happened at the end of 2019 and the beginning of 2020. Now, of course, if this guy with a suppressed immune system, how well do you think he would have held up in 2020 of everything that was going on with you know what? So massive change in his life because of chiropractic. If you're suffering with an autoimmune condition, I would suggest you go get your nervous system checked out by a chiropractor. A good nerve supply is what allowed this guy's thymus to start creating T cells more normally, so they stopped attacking his colon. A good nerve supply to my thymus allowed my T cells to stop attacking my lungs, and I don't have asthma anymore. The innate healing capacity is within you. It does not come from a pill. It doesn't come from a medical doctor. It doesn't come from a chiropractor. It comes from within you. You can't heal by suppressing the immune system. The best way to do that is allow the body to work normally. Remove the nerve interference. Your body's going to have the best chance to function normally. People that are suffering with autoimmune disease, every one of you should get checked by a chiropractor. And if you'd ever like to come in for a consultation about this, we'll see if there's any condition, subluxation that we can find, and if there is, your body can start functioning better.